Last year, the NHS turned 70 and enjoyed a £20 billion birthday present from the Prime Minister. Now they have to work out what they're going to do with it, because many believe the NHS needs some radical change if it's to deliver world-leading healthcare into the next decade. The government's about to publish its 10-year plan for the NHS, so we're joined now by the Health and Social Care Secretary, live from the West Suffolk Hospital. Matt Hancock, thank you for being with us today.
Good morning, how are you?
Not too bad. I hope you're well as well. So tell us, what is in this plan?
Well, as you say, the £20 billion extra that we're putting into the NHS over the next 5 years is there to make sure that it's sustainable for the long term, but money alone is not enough. We need to see a big shift in the way that health services are delivered so that essentially we focus on prevention as much as we do on cure. Of course, the hospitals like this do an amazing job in helping people to get better when they're ill. But increasingly over the last generation, the focus needs to be on making sure that we support people in the community, that we support people through, for instance, through GPs, and that we ask people, as well as giving them rights for free care, free at the point of use, we also ask them to take responsibility to keep the pressure off the NHS and make sure that it's there for people who really need it.
I mean, some people in the Conservative Party will think this sounds a bit like the nanny state.
Oh, I don't think so at all. Asking people to take personal responsibility is the very opposite of that. We then need to empower them to do so. So, for instance, the ability to go and see your GP or to have support in the community, even for somebody who's very frail, to be given the money to be able to make, say, improvements to your home so that you don't trip, so that you don't end up in this emergency department, which is very expensive for the NHS, as well as obviously very bad for the patient. Making sure that we can help people to stay healthy is at the core of what a national health service should be doing. You know, the focus just on what happens in hospitals means that we don't spend enough thought, effort and resources, both government resources, but also asking people to take responsibility themselves to keep people healthy. The whole purpose of the NHS over the next 10 years needs to shift towards helping people to stay healthy as much as curing them when they're ill.
You've got a bit of a problem, though, haven't you? And that's about staff, because currently there is 100,000 vacancies in the NHS. And I just want to talk you through some of the numbers, because I'll be honest, I was pretty shocked when I was doing the research for this interview. 41,000 unfilled nursing posts, 6,000 GPs short of the number that we need, 3,000 midwives short. I mean, your 10-year plan isn't going to work if you haven't got the people to implement it.
Well, of course, when you put £20 billion into something, we're going to need the people to deliver. Absolutely right. And the plan has a detailed workforce chapter, and then there's going to be further work on making sure that we have the people that we need. We need to recruit more, we need to train more, and also we need to retain the people in the NHS who are working so hard now. Taking the pressure off them, actually, is one of the important things we can do to retain them.
So how will you do that?
Let's take the... Well, let's take the nurses figure that you gave, 41,000 vacancies you mentioned. Actually, 30,000 of those vacancies are currently filled, but they're filled by people working through, for instance, agencies rather than full-time. That can be fixed. We've also got to have more, because that still doesn't bring us up to the full complement. And so we're expanding training. We've got an expansion of the training budgets. We're going to make sure that we also recruit better, and we've got to make sure, as I say, that we retain those who are currently working in the NHS. And a lot of that means taking the pressure off.
You sound as if it's all under control, but actually on the ground, if you talk to people, you get a very different picture. I mean, I was speaking to someone, for example, who works in a rural GP practitioner, and they were saying that in the last year, they've advertised for a nurse practitioner, a practice nurse and a GP, and received 0 applicants. And that is not an isolated case. I mean, this is a crisis, isn't it? A crisis where you haven't got enough people who are working in the health service.
Well, this is why we've got a long-term plan, and in fact, we said before that we thought of the 20 billion, £3.5 billion needed to go to primary care and community care. In fact, we're going to be putting £4.5 billion extra into primary care and community care. And yes, that means we're going to need a lot more community nurses. We're going to need more GPs, as you say. We've got a target for more GPs. And this is all part of the plan to make sure that we have people. You know, big picture here, if you step back, we have a population that is aging and also getting wealthier. And as populations get wealthier and as they age, they need more healthcare. And that means that we need more people focused on healthcare and keeping people healthy. So that requires training. It also requires recruitment. And part of the plan is to solve exactly the sorts of issues that you were talking about and exactly the sorts of shortages that you mentioned from talking to the people who you did.
You're talking about the challenges of an ageing population, and of course one of the big challenges facing the NHS is social care. But I haven't found anything on social care in this plan, in the brief that we've been given. So can you tell me when the Green Paper is going to be finally published on it?
Yes, we're going to have a green paper on social care soon. The plan does actually cover the very important links between health and social care, because there's the link between making sure you can get people out of hospital when they don't need to be in hospital but they do need care. That's critical. We'll be publishing the paper in the
when will the plan be
coming
published,
weeks. In the coming weeks, there's a big focus on one other big subject as well in Parliament at the moment. But the plan is the Green Paper is well developed, and it fits with and goes alongside this long-term plan for the NHS.
The other part of the plan that I know that you're very passionate about is technology, and you're talking about targeting people with unhealthy habits. For example, people who enjoy smoking, enjoy drinking, for example, with targeted adverts, a bit like politicians do during election campaigns. So does that mean that medical data will become available to private companies?
No, it doesn't mean that at all. What we propose there is that as part of this this approach to try to support people to stay healthy, in the past, public health messages have tended just to go to the population as a whole. You know, we all know the mantra that you should eat 5 a day. That is a public health message. And it's normally, we give the same message right across the population. Increasingly, with new technology, actually, you can better target those messages. So instead of saying to everybody the same thing, you can say, for instance, if you are a smoker, that is very bad for your health. But if you're a smoker and you're pregnant, then that's not only bad for your health, but seriously bad for your baby's health. And we can target messages at people to try to make sure that they maintain healthier lifestyles instead of, what I don't like in this area is punishing the masses for problems that only a minority have. Take alcohol, for example. A fifth of people drink a third of all the alcohol. Sorry, 5% of people drink a third of all the alcohol in the country. 5%. And yet many of us, like a nice pint, and it's perfectly healthy. So I think instead of things like minimum unit pricing that some people suggest, we should target measures so that if somebody who has a serious drinking problem that leads them to end up using the NHS in a hospital like this, then they should get much more active intervention and counselling to try to support them, so that we're not stopping most people from having a perfectly healthy drink or punishing them, and instead we're tackling the problem where it really is serious.
Now, Brexit, of course, affects all government departments at the minute, and a lot of people are very worried that if there is a no deal, there'll be shortages of medicine. So can you, as Health Secretary, guarantee now that even if there is a deal, that no deal can be reached, people will be able to get the medicine that they need?
Yes, we are confident that if everybody does what they need to do, then we'll have an unhindered supply of medicines. And obviously this is very, very important in all Brexit scenarios. No matter what happens in those negotiations, people should be able to get their supplies. There's an awful lot of work going on to ensure that that's the case, and we're confident that, that so long as everybody does what they need to do, because a lot of this relies on the pharmaceutical companies and others, so it isn't entirely in the gift of the government, but we need to do what we need to do, and the pharmaceutical industry. So far that work has been progressing very well. I've been very pleased with the response of the pharmaceutical industry, who obviously take this incredibly seriously. And frankly, a hospital should get the supply of drugs in exactly the same way as they do now. They shouldn't notice any different, because the unhindered supply should be done within the pharmaceutical supply chain, and we've got plans underway to make sure that that can happen.
Being confident that something will happen isn't the same as a guarantee, though, is it?
Well, the truth is that in medical supplies, there are these sorts of shortages all the time. In the autumn, there was a shortage of EpiPens because of a problem with supply at the factory in America where they were made. So actually, the NHS and the department deal with these sorts of issues all of the time. So that's why I use the language that I do, because there's always all sorts of problems. I mean, frankly, one of the jobs of the health secretary is to prepare for all sorts of things that you don't want to happen, but do happen. We have people at the moment out in the Democratic Republic of Congo dealing with Ebola. I don't want Ebola to be a problem, but I'm absolutely happy to ensure that we put resources into stopping it. So this sort of planning happens all of the time, and we're clear that we're not going to overpromise, but we are confident that the plans are in place, and that so long as everybody does what they need to do, then there'll be the unhindered supply of medicines in whatever the Brexit scenario.
OK, now it was reported in November that you told Cabinet that you couldn't guarantee that people wouldn't die as a result of a no-deal Brexit. Now, I'm not asking you to go into confidential Cabinet discussions. I know you don't want to do that. But can you guarantee that people's lives will be safe?
I'm confident that we'll have the unhindered supply of medicines so long as the plans that we have in place are properly enacted. I didn't actually say what you reported to Cabinet, and I'm really very clear on the position here, which is that there's a lot of work to do to make sure that we get to that position. Some of it's for government, and we are doing that. I now have a whole floor of my department working on this, and we've put money behind it already, as has been widely reported, making sure that there's facilities so that we've got the stockpiles of drugs that we need. But I'm also not going to overpromise. I'm doing everything that we need to, and everything that we can, to make sure that there's the unhindered supply, no matter what happens.
OK. And very briefly, the Prime Minister's going to be putting her Brexit deal back for a parliamentary vote shortly, we believe in the next fortnight or so. Do you think anyone's changed their minds over Christmas?
Well, I certainly hope that the chances of the deal going through have improved. I think if people have gone back to their constituencies, as I have, and talked to normal people, then they will have found an overwhelming sense of just, please, can we get on with it? And the plan on the table is the best plan. It will get rid of all the problems we've just been talking about in terms of no deal. It will also mean that we have both a close economic relationship with the EU in the future and deliver on the referendum result. I think it's overwhelmingly the best way forward compared to either no deal or a second referendum, which would be divisive, hugely divisive, but it wouldn't be decisive because people would say, well, why not have the best of three? So I'm very confident that the plan is the best way forward, and I very much hope that on listening to constituents and taking a bit of time to consider the questions over Christmas, people can back the plan that gets on and delivers Brexit in a way that means that our economy can thrive. We can then support our public services like the NHS, and there's a great bright future out there for this country, and we need to get on with building it.